One of the things that I think makes the Diabetes Institute program unique is its trifold mission. It's not just about research, it's research, education, and caring for folks in our community through services. So having the Diabetes Institute and Heritage College be part of Ohio University has really given us a leg up in caring for the community and researching. We're part of a large, complex university where we're able to do interprofessional education and interprofessional research to really work on the problems that we most see here in Southeast Ohio.
We have a primary care research going on here, basic research, translational and clinical research in diabetes area as well as cardiovascular. So we focus on fat metabolism in relation to type 2 diabetes, obesity and cardiovascular research. So we are studying basic mechanisms of storage and breakdown of fat in human body. So for that we use various types of models. We also use mouse models to study what is going on in fat metabolism and how it is associated with metabolic disease. My goal is to develop therapeutics for type 2 diabetes and cardiovascular disease, and we are fast moving towards that. We have actually identified molecules that are regulating fat in the body in a very optimal fashion.
Diabetes Institute is actually foundational to the Heritage College. Built into our DNA is taking care of the community, and the Diabetes Institute has allowed us to really significantly take care of our communities here in Southeast Ohio.
We are in rural Appalachia. It's the north central Appalachia, so we studied the role of culture and how Appalachian culture impacts diabetes from not only the patient perspective but also the provider perspective. One of the most exciting things that's happened this past year is we have a virtual reality simulation project. And this is a collaboration with many of the schools on campus. What we are aiming to do is we have taken an Appalachian diabetes patient with type 2 diabetes. Her name is Lula May. She's a 72-year-old person from rural Appalachia, and she's had diabetes for 22 years. And the goal is to educate the providers about the culture and also to help them identify social determinants of health so that we can reduce implicit bias as it relates to these social determinants of health as well as culture. We're doing the same thing on a website so that we can then reach a wider market so that anybody can do it on a website.
As Executive Dean of the Heritage College, I was blessed to walk into a time where the college got a transformational gift from the Osteopathic Heritage Foundation, $105 million. A big piece of that was for research, and a big focus of the research was for diabetes research.
The Osteopathic Heritage Foundation is a private foundation based in Columbus, Ohio, and our mission is to improve the health and quality of life in the community through education, research, and service consistent with our osteopathic heritage. The Foundation's support of Ohio University, the Heritage College of Osteopathic Medicine, and its Diabetes Institute advances the Foundation's mission on many different levels. I look forward to continued partnership with the University and the Institute as we collectively work to prevent diabetes in southeastern Ohio.
So I've been in healthcare for a long time, and what I've realized is just like all politics are local, all healthcare delivery is local too. What we've learned here as we've studied Southeast Ohio is that the rate of diabetes is about 20%, or almost 1 in 5 people in Southeast Ohio, particularly around Athens, has diabetes.
The focus of the Diabetes Institute is to improve the quality of life for people living with diabetes, and we do that through our research, our education, our patient care, and our community outreach. People in this region often experience a lot of barriers to managing their diabetes.
5 of the 7 counties in this region have a poverty level of 20% or higher. There are a lot of transportation issues. This is a very rural region. We don't have public transportation. We have a lot of housing issues, so we have a very large homeless population in this region.
We offer our programs in outlying areas of the county to make them accessible for individuals. And in addition, we offer our programs at little to no cost to make them affordable for individuals who need the care the most. Mobile health units address a common barrier to care, and they take the care to people where they need it. The care is often provided in response to an unmet healthcare need, and it's often provided to people who lack any other source of medical care. The Heritage Community Clinic is able to provide quality medical care, and with the benefit of funders is able to provide that care at no cost to patients. In this region of Ohio, there's a shortage of diabetes specialists, so our fellowship program trains primary care physicians to care for this complex condition, and it provides them the knowledge and the skills that they need to do this well.
So I think the future is bright for the Diabetes Institute. We've formed a strong foundation that we're going to be able to grow from, and I'm looking forward to all the great things to come.